Hey, Renee, how are things back in Iowa?
Oh, it's a little drippy, a little rainy, a little damp, cooler, which is nice. I got my sweatshirt on, legit, not from the freezing cold buildings. And so we've got fall. We've got fall. I still see lots of tractors in the fields, though, and I'm assuming maybe that's what's going on with y'all. Are you still hauling grain? Still got grain going?
We are. Grain is rolling, but I'm not there to be farming because I'm on the road going to conferences,
Yep.
which is really cutting into the farmer time, Renee. And so I guess that's my farmer wine of the week is that I need to get focused on getting rid of some corn and getting done with harvest, but it's still a thing.
Well, luckily for you, you have some people hired and to help, right? Because you can
Cur
still be moving grain around even if you're not home. So that's a good thing, right?
Absolutely. So semis are still rolling, whether or not we're there or not.
Yeah. So this particular conference is the Mental Health and Substance Use Recovery Conference. And how is this one different than some of the ones you've been to before? What's different about this recovery conference?
Well, the focus here is really on the peer community and how the certified peers all across the state of Wisconsin can integrate into all of the different systems and promote behavioral health and recovery from substance use disorders. And so it's kind of refreshing. It's a huge conference, over 900 people in person and over 300 people live stream it online. As conferences go, it's one of the larger ones, and it's got great representation, and so many people turn out for it every year.
That's awesome. I was looking at some of their objectives and they're talking about integration of behavioral health and substance use. And since it is more peer focused, peer run, peer led state, are you seeing more integration or is that still kind of siloed?
Well, unfortunately, Wisconsin is a county-based system state. Renee, and you know a little something about
A
that
little
if we
something
go in the
about that.
Wayback Machine. So there's a lot of different ways to implement things. And so unfortunately, sometimes you hear about those hero programs at conferences like where it's going really well. And we'll
Yeah,
talk about a couple of those programs because where it's going really well, it's going really well. But where they can't get it implemented and get the right people at the table, we all know what happens, right? It doesn't go very well. And so, I think it's refreshing when we can hear from healthcare to doulas to jail-based programs to law enforcement co-responders utilizing peers. They're
mhm.
amazing things, but it's not systemic and it doesn't span the whole state.
I don't know this question, and you might not either, but you know how many counties the state has?
I knew you were going to ask that. I didn't look that up.
You did not. I thought maybe they just told you since it's county based.
Oh,
I bet I can look it up
no.
while we're sitting here because I'm like, how many of them are there? Because, with us, it was, we had to have 99, which is kind of a hot mess.
I want
And
to say
so
it's in the 70s because I we did this last year when we were up here because we met with several counties. And
good
so,
job. It's 72. So
okay,
that's
do
a
you know how hard
wide.
it is to keep track of all the states we're in anymore, Renee? I mean, you
No,
know
I
how
know
many
that,
states
but
we're
I thought
bouncing
since you brought
around.
up county by county, you'd know that one. So,
Well,
yes, and some of the challenges with counties, for those that don't remember why the state in Iowa changed, is that you get a lot of fiefdoms, a little kingdoms with a
yep.
little egos, and it goes their way, the highway, their way is the best way. And when we went to try and to regionalize originally and then into districts now, you've got people that are like, the whole state needs to do it like us. And that doesn't work super well. And it doesn't really provide that flexibility. So, I mean, I've been working with Iowa with a primary care association, as have you, and talking to them about what they're attempting to do with trying to make it more,
Yep.
consistent across the state. Is it's a honest goal and it's a hard goal. And so I'm hoping
Oh,
that they can make some progress, but it's difficult because just like you said, I bet you anything the places where things are going better in this state is going to be in those more urban areas. And I bet
yep.
the rural areas are struggle busing a little bit more. Am I wrong?
No, you're absolutely 100% correct. And we see that in every state. We've been in a lot of states here just in the last couple of months, Renee. And it's the same thing we see is you see the innovation, in those urban areas where they can get people at the table, and they have more resources to be able to do it, and they have more workforce. I think I've heard workforce so many times, and I've heard it a little bit less in Wisconsin, and it really gets me thinking about some of our opportunities in Iowa, where I keep hearing workforce in rural areas, but I'm not hearing about how we replace that workforce with others who could do similar tasks. And I think peers are a great example. When we think about, mobile crisis teams, right? If one person is a peer and one person is a professional, that's a great way, and it creates a connection point of someone who's been in their shoes, who knows what's going on, who can provide support and guidance during those crisis moments. There's so many opportunities, and I just don't think we're taking advantage of them like we should, especially in Iowa.
Yeah, and you had mentioned too that you're seeing some jail reentry and some court stuff with peers. So talk to us about how are peers being used in some of those areas? Do you see them as folks that have been to jail themselves and have that kind of lived experience, and so they're kind of coming from a legal perspective, or are they your mental health substance use peers that are just working with people coming out of jail, or is it kind of both, or do you know?
Both. It's both. I listened to a really great speaker today who had spent a couple years in federal prison and then got clean and sober, came out, and she now rides along and she's part of one of the law enforcement communities, I believe in Madison, where they do peer outreach. And so it's a law enforcement officer paired with a peer, and they can get further in building relationships and doing community-based policing by engaging with peers, going out and doing that. And they've created some great not just diversion programs, right? But we're really talking about deflection programs. And I guess, sometimes we don't always dig into the nuances of the difference between diversion and deflection. And a good deflection program really takes folks who would have gotten a charge, and if they go to counseling for 6 months and they do the program, that ticket gets ripped up. It never goes on their record, and they never get into the system. Where diversion is taking people who are already in the system. And I think I really like the concept of these deflection programs that they've created, because they're keeping people who have substance use disorders or mental illness out of the criminal justice system altogether. And they're pairing them with with what they need, so they can be successful. And it's really working well where they've implemented, where they have that team approach between the courts, the peer programs, the counseling programs, and law enforcement. And I think there's a lot to that. And we've talked about different ways to get there. We've talked about the SIMs in our own state that they're looking at, but I don't think everybody understands the difference between diversion and deflection, Renee.
Yeah, well, yeah, there's a lot. There's so many things. I was just talking to Brent the other day about how we need to make a continuum of care for
Yeah.
courts. And he
Yeah.
asked me, he says, is that a thing? Has that been made? And I'm like, I don't think so. I don't think I've seen one, but I could draw it for you because I live it. And
Hmm.
but it's got a lot of circles, right? It's got a lot
Yep.
of loops back to where you go again. And so it wouldn't be so much just a straight continuum of care. It would be like, a little tree where they could go off this way or that way. So one of
And
the things
well, I was
being,
going to tell you before you move on,
yeah,
they just included the Department of Corrections, and folks on probation and parole are now eligible for this program. So if they
oh
have a small
goodness.
slip up, it doesn't have to go against them if they stay compliant, right?
That's
And
a
what
good
I
thing.
think that's a great opportunity. They got DOC on board up here to deliver that. And so 462 people last year would have been eligible for this. They just kicked it off here in July.
Wow.
And so that's kind of their target, right? That's how many folks that they can then keep from re-entering the system when we're talking about really low level offenses that really have to do with their addiction or their mental health condition.
Yeah. So you're talking diversion because they already had charges.
I know,
Collection.
that is
Deflect.
diversion,
Look
but
at
I'm just
that. I
saying
know the
it's the
difference.
same system, it's the same structure,
It
but you can
is.
implement it in different ways
It
if you get
is.
creative, right? We always talk about being
Yeah.
creative with what you already have. What a great example.
Yep. So what's interesting in our state, we're working on the parole board has got a right now having big conversations about the difference between drug users and drug dealers.
Mm,
And a good drug dealer, and that's going to sound like an oxymoron, but the ones that are successful are not users.
that's
They are
correct.
very highly intelligent. They are
Yep.
very influential. They
Yep.
come off looking awesome. They get along well. They can do prison in a second.
Yep.
They're easy to work with. And they're the ones that everybody always wants to let back out to just go out and
Yep.
sell more pounds and pounds and pounds of
Yep.
meth. The users, though, come in and they're not doing awesome. They're not following the
No.
rules. They don't even really know
Right.
there are rules at the beginning. They really struggle because they're addicted and they
Right.
come in and they end up staying longer, which is
Yep.
backwards because it's like the folks that really have the addictions get
Right.
stuck in these patterns of habitual poor choices. And so then they just reoffend, reoffend, reoffend. And so it's a really a messed up system the way that it's created to punish or to rehabilitate these folks because the ones that are addicted struggle with the
Yep.
rehabilitation as they would because they're addicted. And so
Yep.
the others don't. And so it's wild because the folks causing the more illegal behavior, the really big illegal behavior, look like model people. And so it's not on face value what we're looking at here, but that makes a lot of sense. And so, trying to figure out, predicting who this is that's going to be able to do those types of programs. And so in our state, those are drug courts, specialty courts, mental health
Yep.
courts, lots of different places where people come along. Some of the challenges, though, we're seeing in our state, at least our state, lots of really young people, their very first crimes are very big crimes with
Yeah.
guns. And they're coming in with, close to life sentences. And there's not an opportunity, even if they were using when they make those choices, to even intervene because they're coming in off
Yep.
the top with this very big bad choice. And so those are a lot harder for us because we're getting young folks that are out and about doing some real bad things, which I've heard about also happening in Wisconsin, and did
Yep.
some work up there with some of the different shootings and issues in the
Yep.
parades and different things that have happened. And so, yeah, it's problematic across the country, but it is hard because you're trying to intervene, especially with young people whose brains aren't fully formed and wanting to make sure they have an opportunity for rehabilitation. But when you come in off the top with massive charges, it's really hard to figure out how you're going to help.
Yep.
So some of the data that you're looking at here, it sounds like that they are saying we don't really know what we're looking at. Is that what
Well,
you're
I
getting
mean,
out of data? I mean,
I was actually in a session and I kind of thought to myself, maybe we all need to step back and reevaluate what we're evaluating because
what are
we
we
get
looking at?
stuck, right?
Yeah.
We get stuck in it. And I started thinking about our own system, right? We evaluate whether you get an appointment with a therapist or whether you go into the program, right? That's how we measure success, is
Right.
completing the program. But do we ask any quality of life measures, right? Does it matter that you completed the program, or does it matter that your life is better after whatever the intervention was? And maybe the entering and going through a program had nothing to do with why you're doing better, right? Aren't we just trying to change quality of life? And so I really like that some of the folks up here have shifted to quality of life measurements
Hmm.
over just completed the program,
Hmm.
right? And it really got me thinking about how we collect data and how we look at data, because
Yeah.
sometimes it's a checkbox of they went to the first therapy appointment. We don't care what happens after that because all we said they had to do was go to the first appointment or receive the evaluation. But we're not looking at, have we moved the needle on someone getting better? And I think that we should all take pause.
Preach it to the choir here. I mean, we have treatment programs inside prison at our
Mhm.
level and at the federal government level where the goal is for rehabilitation, but they
Right,
don't measure necessarily
right.
rehabilitation. You measure, did they sit in the seat the whole
Yep,
time? Did they have to restart the program because they didn't get something completed? Did they, so these boxes that you're hoping equals rehabilitation
right,
when in reality they don't. And you're
right.
right, because we're trying to put, kind of these weird squares in these round holes and trying to say, well, they were there the whole 12
Right.
weeks, therefore they're rehabilitated. And you can tell we interview people and ask them questions about what they've learned. And we've made a point to learn about those classes so we can ask
Mhm.
intelligent questions. And sometimes they don't have one idea. And we get through that and
Right.
going, they did not even understand the acronym, the main acronym of the whole thing or whatever, can't even
Yep.
tell you what it means or what's a value in a period. What is a value? And so you're like, what did they do in those classes, right? And so you think about that, and that's in a captive audience. Think about what
Mhm.
that is out in the current, and happens with probation, parole, folks
Yep.
out there that are required to get that evaluation, and they're supposed to be compliant. Who measures that, and what does that even look like? So it's good to hear that they're looking at other things, but like, what else is going on up there with your data in that system? I think you were talking
Well,
about some stuff with justice and mental health.
yeah, I mean, we talk about it, but like, how do you actually start to move the needle on this? And so there is a program. We're gonna drop the link in the show notes. It's the Justice and Mental Health Collaboration Program. There's some federal grants out there right now that providers could go for that will help them to partner with their local law enforcement entities and start to develop ways that they can measure things differently. And so some of the programs we heard about here that were really those rock star programs started because they were able to access some of these federal dollars. And there's more of those federal dollars available. And we always don't know how to get started. And so, this is a great example of there actually are people out there that can help you get started. I also learned about, we do this all the time. There's actually some SAMHSA programs that will provide coaching to organizations that take SAMHSA funds and help them better integrate within their communities. They started up last year. Some of them had difficulties expanding into other states. I talked with them today, and they need help integrating into Iowa because no one's responding to their emails. in the state. I know it's hard to believe that in our home state, there's certain people not responding to their emails.
Well,
And
and
so,
you and I know, let's just take a pause right there. We know that they're a little overwhelmed in our state. I mean,
oh,
how many more
I
system
know,
changes do you need all at
I
the same
know,
time?
I
And so
know,
they're
but
gonna I mean, they may be thinking, Coach, what? We don't even know what we're doing. So
I know,
I mean, you on the one hand, yeah, you want to take the federal help, but on the other hand, if you're not in a space where you know
right.
what's even happening or which side's up, you may not be ready for the coach quite yet. Or the coach might not be ready for what you're about to say. So it could be a
That's
two-way street
absolutely
on that
true.
one.
But we hear we don't have resources, and here we are
Right.
finding
Right.
resources. We've found
Right.
so many resources we can
Right.
bring back to our home state just because we're out here making connections. And it goes back to what we always say. You got to go in person and understand what's happening. And your community can be as big as the 6 states surrounding you. It can be your state, it can be your town, it can be your county, whatever you consider it to be. But there's more resources than we give ourselves credit for. And so it just really excites me when I find out something new and I'm like, hey, we can bring that back and we can help somebody out and we can build a better system.
Right. And there will be people and some entities that are absolutely ready for that next step and that coaching. And so they don't even know that that exists. And that's some of the things that, even though people in our state are being frustrated by the statewide system, some of the potential and the hope that's there is that those kinds of resources would all be kind of pooled at one location so that everyone can know about them and apply for them if they are, and get the federal dollars connected now to the state dollars so that you know where they're going and they're not just a little bitty office within HHS or within
Right.
public health, and you don't even know what the dollars are for. And we bought a bunch of
Yep.
bumper stickers. It
Yep.
could be something different. And so I get where they're going, and I get why they're trying to reallocate the resources because you need to do them all more
Yep.
smart. That's more smart than we have been. So you've got a lot of stories here to tell us. And so first, my first question, because we never got to talk about this, but couple conferences back, there was a donut beer run, and
Yeah, this
I
is
don't
a
think you got to tell the audience how that went for you.
I don't, I don't know if this is the episode we should talk about that when I'm at a recovery conference, Renee.
Well, and
And
you're in
so this is the
Wisconsin, who is the
variation.
number one state for drinking in the US. So I think it's 100% appropriate because they don't have a
That's
donut and
true.
beer run there.
That
Instead,
was the
Jason, you're
tie
supposed to be
together.
at yoga. You are not
I
supposed to
know
be here.
I am missing yoga for this.
Yes,
But I
for
do
the
want
good
to
of the
get to
cause.
I actually the DHS roundtable is starting right now. So I am going to run down right behind me to the DHS roundtable. Um,
What is that?
the the variation in activities at conferences is pretty wild. And so, this is a recovery conference, right? And
So you
so
get yoga.
and we get yoga and it looks different, and so there's certain traits of conferences. Some of the other hospital conferences we go to, they promote drinking at the conferences. And so, there's a
Different.
balancing act here of it's just a different mindset as you go around. And so it is something to think about. Although I was struck by some of the t-shirts here today. There were some
Okay.
organizations
Okay.
that have t-shirts, and on the back, one of them, I mean, it just kind of made me chuckle, right? One was Hope Dealers. There's an organization around here that has on the back of all their t-shirts Hope Dealer, that they're out
Okay.
dealing hope everywhere they go.
Nice.
And I think that is really an awesome reframe, right? Because
Yeah.
a lot of folks here went from dealing drugs to dealing hope. And I think that does kind of summarize the spirit of this group up here. I also love the t-shirts I saw that recovery is dope. And so again, I think it's really good when folks can take where they've been and reframe it and come at it from a different angle.
They should not watch the Charlie Sheen documentary. That's not what that
Okay.
means. Okay, so one of the things we're talking about here with recovery, just no, don't watch that.
Cool.
Problematic versus problemish. What in the world does that mean?
You
Tell
know,
us.
like, I kind of like this and I'm going to use it, right?
Oh, okay.
Because Renee, you've been known to be problemish when
I
you
have.
go and solve problems, right? Because
Yeah.
how do we fix things? We can't be problematic about going and calling people out, but if we're problemish and persistent, that creates change. And so
Okay.
I like the reframe on saying, you know what? A lot of times we are being problemish when we go and we ask questions and we do things, right? But that
True.
doesn't make it problematic because problematic is a bad thing. What we're doing is trying to fix it and make it better. And so it's good to
Okay.
be problemish. And so I'm going to actually strive to be more problemish when I'm talking with people, when I'm trying to get people to think about things differently, because I don't want to be I don't want to be a problem for someone, but I do want to be problemish in my approach to a lot of things I do. And so I think
Yeah.
you've been problemish over the course of how many years that you've been doing
A
system stuff,
long
Renee?
time. I know. And what's so crazy about being problemish, and I'll claim it, I don't mean to be. Sometimes you ask
Right,
questions, right?
right.
And you ask they say things and you go, "Did you just say?" And
Yes.
repeat it. And then they look at you and you're like, "Wait, that like for example, back in North Dakota, beginning of my time of the very
Yep.
first time, when
Yep.
they told me they had lifetime case management. Like if you
Yep.
were a client for somebody and you were number 32, you were 32 till you died. And I
Yep.
was like, what? And so people were full of
Yep.
all these people that really weren't cases because they were full. And to an outsider, I was like, what? And so I wasn't rude, I wasn't mean, but I made
Right.
them say it enough times that they heard that
Right.
and had to make change because that's insane. Because, of course, they were all full because they
Right.
had all these inactive people on every single caseload because they
Right.
were on caseload for life. And as soon as you named it caseload for life, they were like, what? Like, well, that's what you
Yeah.
just said. So sometimes it's not trying to be a problem, but at the same time, you're like, did you hear what you said?
And
And when you reflect it, they go, ooh, that's not what we need or mean. And you're
thus
like, right.
thus the term problemish. I think it's a much better way of describing it. So that's, I think, what our new that's what we're going to
Yeah.
strive for.
I
Um,
think I think you get to be problemish when you sit in a place and they say that the mobile crisis department doesn't speak to the sheriff. I bet you're a
I,
little bit
I
problemish.
do become problemish at that
I bet you
point.
do.
That's a fact.
I bet you do. So you were mentioning there's a couple places that have recovery in a couple of different communities, but they don't speak. This kind of sounds like the sheriff and the mobile crisis. Do we have people that are competing in two different communities, but they're not doing the same things, but they don't get along? I mean, tell me about all of this. What is
Yeah,
this
of
going on?
course, and I think that's kind of the flip side, right? We talked about those really great integrated programs that we heard examples of, but we also know on the flip side, there's programs that haven't been able to integrate, that haven't been able to figure out those pieces yet. And I think that's kind of, we talked about some of this earlier in the segment, Renee. So now you're throwing off the
Oh,
whole,
sorry.
that's okay. So
But I
some of
wanted
this,
more details. I don't know what are we talking about. Or two urban communities that are just like
right, they're doing
both
it
have the
really well.
best, but they don't
Yeah,
like how the other one does it, like
right.
that.
Well, okay, now I know where we're going, right? That it's actually a different model. See, I know. I'm just trying to catch along.
I don't know what we're talking about.
Exactly. They both do something similar, but don't follow the same model, don't have the same
Oh,
philosophy. And so, although they're both functioning, there's really no way you'd have to pick one or the other if you want to go replicate it somewhere. And so, it was
oh,
actually funny because in the session, the ones talking about how great they do, they referenced the other one. And then finally, an arm went up in the back and said, oh, hey, I founded another program and I work at the other program. And we actually do it this way. They don't even communicate with each other, right? And so, how do you learn? How do you develop things? And that's in the
right.
same state, right? And we see this all the time, right? That
Yeah,
everyone tries to create it from the ground up by themselves, as
right,
opposed to the shared learning that can get everyone so
right.
far
Well,
ahead.
when we thought about this, like when you started the mobile crisis in our state, you had four distinct different models, and
We still
everybody's
do,
model was the best model depending upon who you
right?
asked. And when it goes then to try to get to 988, you've got two different models of how that worked, whether it went to 911 first or 988 first, or how they communicated was a third way of how they connected. And so when you put all of those together, because you're supposed to answer a phone and go out, seven different models then did not work together. And then when you try to figure out a place to go, oh, the number escalated as to how many different opinions about all that. So it got really complicated really quickly when you're trying to implement something federal that everything needs to be the same statewide. All of a sudden, it doesn't work.
There, I've been told there's not any. I got to go fact check this, but I've talked to two or three providers, mobile crisis folks, and of course it's different. Every county has their own mobile crisis team. Every county has a different phone number or way to access that team,
Ugh.
and they really do promote 988 here. But yet the counties have their own thing to access those things, so it's much more complicated here. But I said, well, how do CCBHCs work with that? And they're like, what? I don't think we have those yet.
Oh, okay.
So there's a
Or they
lot of,
don't know the acronym.
or that could be that too. So, I think that's the opportunity we have. So It's been a learning experience, Renee.
Well, I mean, the highlight of that for me is that we're not alone in our challenges. And when you go to other states, and sometimes, okay, a state will claim that because it's a red state or a blue state or this kind of governor, that kind of governor, that's why you have these issues. Nope.
It's not that.
It's the same. And as we've
Yep.
talked to folks in California, we've talked to Illinois, we've
Yep.
talked to everywhere, right? We all struggle, and it has nothing to do with your political affiliation, and it has
Yep.
everything to do with lots of other things. And so it's like we get bogged down in the politics of it all when that's
Yep.
not really what this is about. It's a more of a human issue and more
Yep.
of a collective, all of our issue. And so, those are the things that give me hope about we can make change, because it's not about where I live or who's elected or whatever. You can make change and you can make it better because it's an everybody thing, not a specific type of person thing.
Absolutely.
That's always a good takeaway, even though you hear some strange stories while you're out and about. Well, today, before we go, I'm going to go into the recovering politician self-care policy of the week. And I've said it before, but I'm going to say it again. I really like my work from home day each week. Especially when I'm the only one here. Now that you all are out and about more, it is interesting to have the house back to myself. For many years, I was a consultant and worked at home a lot by myself. And it's not been that way for a while since Brent came home a few years back in the house. And then, with him being here more than because I now have an office out, it's just been different. And so it just hits differently when I'm here and I'm by myself. I'm amazingly more productive of getting stuff done. And I don't know why, because he'll tell me it's not his fault. He's not bothering me. I don't know. It's just me because I just know he's here. It's different. And I know you and I've talked about that before when Jennifer's home for breaks or
Yep.
your kids are home for breaks
Yep.
or whatever. It's just different because you got some extra folks in the house. But it really sits different when I'm by myself. And I can just be much more focused and get a lot of things accomplished, just whatever version in the order in which I need to get it done. So I really, really like a day of the week different from my regular routine. So if you're a person that's home most of the time, probably going someplace else would be the same for you, to not be home all the time, but to have a different location, because that's just that fresh look of something else for that one day is like massive. I can't believe how much different that is for me. So I don't know, for you, you don't even know what a home looks like lately. You're not even there. You're just out and about.
No, and even when I'm at the same hotel for 2 nights, like this example, I actually had to check out this morning and take all my stuff to the car because I had to move rooms because they were sold out and couldn't put me in the same room for 2 days in a row. So,
Weird.
I've been living out of a suitcase this whole week because we were traveling all week. And so even the day I'm in the same place 2 days in a row, I still had to pack up at 7:30 to get over to the conference on time and throw all my shirts in the car, throw my bags in the car, then come back and check in and do it all over again this
How fun is
afternoon.
that?
Oh, it's
Wow.
just a joy. So
It's a joy.
I don't know how that relates to anything you've said, but that's all I could think about through all of that. I'm like, I can't
What can you
even
do?
relax in my own space because I'm just schlepping stuff back and forth.
You don't have a space right now.
I don't have any space.
So
So
today we talked about the Wisconsin Mental Health Substance Use Recovery Conference. Jason's up in Wisconsin, learning all about things, skipping yoga, gonna go talk to DHS instead, and talking about just peer-led and peer-led programming and how they're making some real changes in workforce by adding a group of people who have life experience, who know what they're doing in this space. What a brilliant idea. So it's good to hear that they're leading with that, making some change. Downside, still county by county government, so it's not going to be equal access. And those are the challenges that we face in our state too. So before you go, please follow us on LinkedIn and Facebook and YouTube. And if you do, we'll send you guys a prize. Have a great day, everybody. We'll see you next time.